so urinary tract infections can be common. The early signs you would probably notice is that urine becomes cloudy, and your urine tends to be clear and light yellow, but once it becomes cloudy, that might be an early sign, and it might trigger you to see your GP or get this assessed. Another sign would be the need to pee more often, so we call that urinary frequency. And another sign would be the urge to pee strongly, so we call that urinary urgency, and that could be a result of some inflammation within the bladder lining because of an infection. You may feel that you can't empty your bladder very well, and that could be also related to the inflammation caused by the infection. You may feel that you go frequently and there's dribbling, and you feel that there's still some amount there. Burning sensations we call dysuria, and that's what people describe as stinging when they pass urine, or maybe feeling like they're passing urine with glass within it. That's a typical complaint, which will be what we call dysuria, an early sign. You may have some discomfort in your lower abdomen, also part of the inflammation related to the infection or the impending infection. And you may feel you have less control of your bladder, so you may feel that you have urinary leakage and unable to hold your bladder as you normally do. I think you probably should seek medical assistance and review. Recurrent infections could be a sign of significant issues within the urinary system, and depending on how bad your symptoms are, certainly in terms of getting an understanding of why you're having the infections would be something that we'd recommend getting assessed either with your GP or with a urologist. So this is quite a common inquiry that we have. People have always tried to self-treat in the first instance, and a lot of people have been successful with that, such as taking all the measures of drinking more fluids to flush the system through, maybe taking some over-the-counter remedies, maybe taking cranberry juice or cranberry extract tablets. And if their symptoms have improved with this, then they may have avoided the need for seeing their doctor. This has been studied for many years, and there's some good data and some unclear data. As I've mentioned before, drinking plenty of fluids is the first approach I would say. My advice would be to say perhaps drink 50% more than you normally drink to really flush the system through. And there's been good evidence on studies in different patient groups that you can potentially reduce the need for antibiotics by half. So certainly that's really important. And I would say probably drinking regularly throughout the day rather than just remembering at the end of the day, and drinking 1.5 to 2 liters at that stage. And other things that people have tried, and I've mentioned before, was trying cranberry juice. Unsweetened cranberry juice is probably a good idea because it can be very it can have a high sugar content otherwise. And it's been studied quite a lot, and there's been Cochrane reviews, and certainly cranberry juice tends to make the bladder area less favorable for bacteria to take hold of, and makes it more acidic. And I'd suggest to some patients to try it because it's also quite generally safe to take. The third aspect is there's been studies is whether you take probiotic supplements, and this has been studied probably over the last 10 years, and it does have some effect on reducing the risk of infections, although it's not completely clear cut when looking at all the studies on it. Not really a remedy, but also sort of conservative measures is depending on what category or what group you're in. For example, after intercourse, if you do empty your bladder fully and make a specific attempt, then that certainly reduces the risk of infection. In terms of other natural supplements that have been out of the market, D-mannose has been quite well studied, and there is quite good support among my colleagues in urology to use that. We can't prescribe it. It's something which can be over the counter, and both health food stores have it, and it works in a really nice way, but whereby it mimics the lining of the natural urinary tract, specifically a sugar which is excreted by the kidneys, and so the bacteria will attach to this sugar and it'll be excreted, and that will stop the attachments of the bacteria to the urinary tract lining. And that avoids the need and all the issues with antibiotics, especially when patients take antibiotics for long term. And so, yeah, there are a number of non-antibiotic treatments we can use in the urology clinic. One such treatment is called Hiprex, which has recently been proven to be as effective as antibiotic treatment, and essentially it works by reducing the urinary pH, so the acidity in the urine, to make it less favorable for the bacteria to take hold and cause symptomatic infections. Another treatment we do in the urology clinic is bladder installations, whereby we place chemicals in the bladder through a temporary catheter, and these chemicals replace the natural bladder lining, which tends to be lost in patients with bothered by recurrent urinary tract infections.